Good afternoon. It's Friday afternoon, the 27th of March, and I'm Alan Vandriel, the CEO at Smith County Memorial Hospital. With me today is Dr. Justin Overmiller from our medical staff here, and we just wanted to give you a little bit of a weekly update on where we are in Smith County as far as the coronavirus pandemic. So, our status here remains that there are no positive cases of coronavirus that we're aware of in Smith County. We have tested some people, but we do not have any positive cases. So we continue to be thankful for that. And one of the things that we want to talk just a little bit about this afternoon is the continued importance of social distancing that you're probably all tired of hearing about. And I'm going to have Dr. Overmiller talk a little bit about the importance of that.
I know I'm tired of hearing about social distancing. Me and Alan are not practicing it right now, so I think everyone knows the deal with that at this point. And I think the thing to remember about that is this is a virus that is spread mainly by respiratory droplets. And so really to become infected, you probably have to be in fairly close contact with someone who is coughing, probably they're running a fever. That is the most common time that people actually shed virus and put it out there in the air for us to breathe in and get infected. So that is the most common way to get infected with this virus. The social distancing, what that allows is for if you stay 6 feet away from someone, even if they cough, that virus is going to fall down to the earth and not make it into your mouth. And that's what we're going for. We'd really just ask that you take that seriously. That is the single biggest way this spreads. That is the single biggest thing that you can control about keeping yourself safe. There are a lot of things that seem like they're out of our control right now. These are kind of unprecedented times. So that's something you can do. Practice good hand hygiene. There's always a chance that you could pick something up on a surface, although it's not the primary way this is spread. So good hand hygiene, wash your hands for 20 seconds with soap and water. Use hand gels if you have any available. That's getting in kind of short supply. I would also tell you, we've heard a lot, people being worried about receiving mail or groceries or those sort of things, and the virus maybe being on it. There are a lot of things out there in the media about the virus being able to live for X amount of hours, and the truth is we just do not have any really known illnesses that have been caused in that fashion. So I think you're safe to bring your groceries home and put them away and eat them. Open your mail, you can wash your hands afterwards, that's fine. That is not going to be the main way that you get this virus. So just maintain good social distancing. Stay 6 feet away. Don't gather in crowds. That's the best thing that you can do to control your risk for this virus. In that vein, we are just asking if you feel like you need to be seen by a healthcare provider, please call. We are trying to have systems in place so we limit everyone's risk to someone who may have this virus, from people that may be at the hospital receiving care themselves to us as healthcare providers. We're going to treat things a little bit differently right now if you have a respiratory virus, or respiratory symptoms, I should say. So please call ahead if you can. That gives us a good update, and we'll act accordingly. I would also just tell you, this is a time where I think a lot of schools aren't in session, kids are coming home from college, those sort of things. Be careful about going to visit your grandparents and those sort of things. Both the Kansas Department of Health and Environment, the CDC, our own Smith County Health Department, they have very good recommendations about if you've been in an area that has a lot of the virus, that you should quarantine yourself. You should not be in contact with other people. That period of time is still about 14 days. Certainly don't be in contact with people that are at risk of not doing well with the virus. So just ask you to keep all those things in mind. We'll get through this. It's important to just remember that most people are going to do fine with this virus. There's a small percentage of people that are going to have trouble. We're trying to conserve our resources for that percentage.
So just a recap then of where Smith County Memorial Hospital is in terms of our response. That really has not changed very much this week. As we talked about last week, we have restricted visitors in the inpatient setting to one visitor per patient. We are still seeing patients in the clinic on a regular schedule. So if you have an appointment scheduled in the family practice clinic, they are still seeing patients here. You may get some questions in some settings, you may get questions by phone ahead of time as to whether you're having symptoms or not. Some of our outside services in particular have asked us to do that kind of screening. We are limiting our surgical procedures here right now, primarily as a way of conserving our PPE, our personal protective equipment resources. But otherwise, we're pretty much doing everything that we normally do. As I said, we're restricting visitors in the inpatient setting. Our cafeteria, per the recommendations from KDHE and through our local health department, our cafeteria remains open only for takeout meals. So you can still take advantage of Chef Steve's healthy food that he offers on a daily basis, but it will have to be on a takeout basis. We are continuing to provide meals for the recipients of Meals on Wheels, and we have every intention of continuing to do that and get those meals delivered to the people who need them. So in a nutshell, that's we're basically in the same place we were a week ago in terms of our response. No big new developments, no positive cases in Smith County. Continue to be safe and have a good weekend.